Introduction to feline tetanus. Tetanus is an acute and potentially life-threatening condition caused by Clostridium tetani, a neurotoxin-producing bacterium. The bacteria are commonly found in soil and can enter the body through wounds or injuries, leading to severe muscular spasms and stiffness, a hallmark of tetanus in affected species. While tetanus is well documented in humans and dogs, its occurrence in cats is significantly rarer. Cats are considered 12 times more resistant to tetanus compared to dogs and 2,400 times more resistant than humans. This resistance likely contributes to the reduced prevalence of the disease in felines. However, despite this resistance, cats can still contract tetanus, primarily when an injury or wound becomes contaminated with Clostridium tetani spores. Once inside the body, the spores germinate under anaerobic conditions, releasing tetanospasmin, the potent neurotoxin that interferes with motor neuron function. The toxin spreads through the bloodstream and the nervous system, causing muscle rigidity, spasms, and in severe cases, generalized paralysis. Given the low incidence of feline tetanus, most of the existing literature on the condition comprises isolated case reports or small case series, making it challenging to generalize about clinical presentation, treatment, and outcomes. This study, a multicentric retrospective analysis, aims to fill this gap by reviewing 27 cases of feline tetanus diagnosed across 11 veterinary centers in Europe between 2005 and 2023. By analyzing these cases, the authors sought to provide a comprehensive overview of the clinical signs, diagnostic approaches, treatment protocols, and outcomes associated with feline tetanus. The study's findings are compared with previous reports, providing valuable insights into the disease's characteristics and management in cats. Methodology. The study is retrospective in nature, meaning the researchers reviewed existing medical records of cats diagnosed with tetanus over an 18-year period. Data were collected from 11 veterinary referral centers across Europe. These centers were chosen for their expertise in neurology. As tetanus is a condition that primarily affects the nervous system, an accurate diagnosis often requires specialist input. The inclusion criteria for this study were strict. Cats were included only if they had clinical signs consistent with tetanus as assessed by a board-certified neurologist or resident under their supervision. Importantly, other potential causes of muscle stiffness or neurological deficits, such as orthopedic disease, myotonia, or central nervous system disorders, had to be ruled out before a diagnosis of tetanus could be made. This careful exclusion of differential diagnoses helped ensure the study's focus remained on tetanus as the primary cause of the clinical signs observed in these cats. One of the key challenges in diagnosing tetanus in both humans and animals is the lack of a definitive ante-mortem test. While blood tests and imaging can provide supportive evidence, the diagnosis is primarily based on clinical signs and patient history. For this reason, the study relied heavily on the clinical expertise of the neurologists involved in the care of these patients. The cases were classified into 3 categories based on the severity and extent of muscle involvement. 1. Focal tetanus. This form of tetanus affects a localized area of the body, typically one muscle group or limb. Focal tetanus is generally considered less severe and has a better prognosis. 2. Multifocal tetanus. In these cases, multiple muscle groups or limbs are affected, but the disease does not spread to the entire body. Multifocal tetanus presents more significant clinical challenges and may require more intensive treatment. 3. Generalized tetanus. This is the most severe form, where muscle stiffness and spasms affect the entire body. Generalized tetanus is further divided into grade I, mild to moderate muscle involvement, with preserved feeding and urination abilities, and grade 2, severe muscle involvement, preventing basic functions like feeding and urination. Data collected from the medical records included signalment, age, breed, sex, housing environment, indoor-outdoor, clinical signs at onset and their progression, potential sources of infection, diagnostic findings, treatment protocols, complications, and long-term outcomes. By analyzing this comprehensive data set, the researchers were able to identify trends and patterns in the presentation and management of feline tetanus, clinical signs, and epidemiological features. The 27 cases of feline tetanus reviewed in this study provide valuable insight into the disease's epidemiology and clinical presentation. The majority of affected cats were domestic short-haired DSH, with 1 Abyssinian and 1 Bengal included in the cohort. This finding is consistent with previous studies on feline tetanus, which have predominantly involved DSH cats. The overrepresentation of DSH cats may be due to their high prevalence in the general cat population, rather than any breed-specific susceptibility to tetanus. The median age of affected cats was 4 years, ranging from 0.6 to 12.1 years. Younger cats appeared to be more commonly affected, possibly due to their increased likelihood of sustaining injuries while exploring their environment. Neutered males were the most frequently affected, comprising 51.8% of the cases. Although this finding may also reflect the general population demographics of cats seen in veterinary clinics, seasonality played a minor role in the incidence of feline tetanus, with cases distributed fairly evenly across the year. However, a slight increase in cases was observed during the spring and fall months, likely reflecting the increased outdoor activity of cats during these seasons. Notably, most cats in the study had outdoor access, which increases the risk of injury and subsequent infection with Clostridium tetani. Only 3 cats were strictly indoor, and 2 of these had recent surgical procedures neutering, suggesting that even indoor cats can be at risk if they undergo surgery or sustain injuries. The median time from the onset of clinical signs to presentation at a veterinary neurology service was 4 days, with a range of 0 to 14 days. This delay in presentation is significant, as early recognition and treatment of tetanus can improve outcomes. In most cases, owners first noticed lameness or stiffness in one limb, often associated with a wound or injury near the affected area. This localized presentation is typical of focal tetanus, which was the most common form of the disease observed in this study. In 65% of cases, the initial clinical signs were confined to a single limb, but in many instances, the disease progressed to involve additional limbs or muscle groups. The progression from focal to multifocal or generalized tetanus was typically rapid, occurring within a median of 4 days. Cats with generalized tetanus exhibited stiffness in all limbs, with varying degrees of muscle involvement. In the most severe cases, cats were unable to feed or urinate independently due to the severity of the muscle stiffness. A key finding of the study was that the severity of muscle stiffness was not uniform across the body. In nearly all cases, the most severely affected limb was the one closest to the site of the initial wound or injury. This finding suggests that the toxin may have a localized effect before spreading to other parts of the body. In some cats, the tail or facial muscles were also affected, although this was less common than limb involvement. Diagnostic findings. Diagnostic testing played a crucial role in confirming the diagnosis of tetanus in these cats, although, as previously mentioned, there is no definitive ante-mortem test for the disease. Most cases were diagnosed based on clinical signs and exclusion of other potential causes of muscle stiffness. Blood work was performed in 24 of the 27 cats, with unremarkable results in most cases. However, 9 cats exhibited elevated serum creatinine kinase CK levels, which is indicative of muscle damage. This finding is consistent with the muscle spasms and stiffness observed in tetanus, as prolonged muscle contraction can lead to muscle injury and elevated CK levels. In 4 cats, increased serum amyloid ASA levels were observed, suggesting an inflammatory response. Electrodiagnostic studies were performed in 12 cats and provided valuable information in confirming the diagnosis of tetanus. In 11 of these cases, the studies revealed continuous motor unit action potentials MUOPs, which are characteristic of tetanus. These spontaneous discharges of motor units reflect the loss of inhibitory control in the spinal cord, leading to the sustained muscle contractions seen in tetanus. The presence of MUOPs was most pronounced in the limbs closest to the site of injury, further supporting the localized nature of the toxin's effects. Interestingly, the electrodiagnostic findings varied depending on the level of anesthesia used during the procedure. In 8 cats, the MUOPs disappeared under general anesthesia, while in 2 cats, the discharges persisted even during anesthesia. This finding suggests that anesthesia may reduce, but not entirely eliminate the hyperactivity of motor neurons in some cases of tetanus. It also underscores the importance of performing electrodiagnostic studies in awake or lightly sedated animals, as deep anesthesia may mask the diagnostic findings. Imaging studies, including radiographs, ultrasound, and magnetic resonance imaging (MRI), were used in several cases to rule out orthopedic or spinal diseases. In most instances, these studies were unremarkable, reinforcing the need to consider tetanus in cases of unexplained muscle stiffness, especially when there is a history of injury or wound. In 3 cases, the bacterial culture of wound material successfully isolated Clostridium tetani, confirming the presence of the bacterium responsible for tetanus. In 1 case, a definitive diagnosis was made using the mouse bioassay, MBA, a test that involves injecting serum from the affected cat into a mouse to detect the presence of tetanospasmin. While this test is rarely performed,